Now. It takes more than an apple a day to keep the doctor away. Body and Soul on 938 Now.
It's Body and Soul right here on 938 Now. I'm Daniel Martin. Welcome aboard. I always say let's take charge of your health. In today's edition, I couldn't mean it more. The surgery that we're going to describe to you today could save lives. Most people are familiar with the term of maybe bariatric surgery, gastric bypass surgery, or weight loss surgery. That's how we, the common person, has heard about it. But really, at the end of the day, what it's doing is on a metabolic level. It's known as obesity and metabolic surgery. It's increasingly being known as obesity and metabolic surgery today. And it's not just about helping people cut down their figures. The life-saving, proven benefits of this kind of surgery is what we're going to explore, because there are implications, for example, of reversing someone's diabetes, even helping prevent heart disease as well. So, how can the right kind of patient truly have their lives saved through this? I'm finding out more on today's edition. I'm joined by Dr. Melvin Look, who's a consultant general surgeon out of Pan Asia Surgery Group. They're located at Parkway East Hospital. If you have any questions, I'll be accepting WhatsApps and phone calls in the third segment of today's show. Dr. Look, welcome back to the program. Thank you for being here.
Thank you for inviting me, Daniel.
Pleasure indeed. Let's talk about that. I mean, most people think of it, like I said, in those terms. But obesity and metabolic surgery, is it the same thing as weight loss surgery?
It is technically the exact same surgery that we do, but the indication is the difference. So now we are doing this operation not for obesity and weight loss alone, but we're trying to do this for people who have metabolic syndrome, particularly diabetes, to reverse some of these problems. So the indication is what is different. Therefore, it's called metabolic surgery rather than weight loss surgery.
Right. We're realizing, and now we've done it for so many years. It's been done for so long, hasn't it?
Yes, correct.
And we're realizing the wider benefits and implications.
Correct. Not just weight loss alone. And I think the indication part is important because a lot of people who are obese, they might think, oh, I accept that I'm overweight. I don't want something to look nicer, but now you're saying...
I don't want to be thought of as vain as well.
Correct, but now you're saying this is an operation that can actually reverse the problems, the medical problems that you have. So the indication is different, and that's important.
Yes, it's not just appearance. The medical problems are significant. I'm talking about greatly increased risks of things like diabetes, gallbladder disease, hypertension, insulin resistance, sleep apnea, GERD, and so much more. And for many people who might find themselves at that point where they are exploring this as an option, they are really on the precipice where their doctors are warning them that a serious incident is right around the corner. Isn't that true?
That's right. Well, as you know, metabolic syndrome is a complex disease, and it comprises things like hypertension, high cholesterol, and diabetes, and that leads to heart disease, leads to stroke and all that. But by far the most important component that we're trying to reverse is diabetes, because that one has, that leads to microvascular problems, it leads to blindness, it leads to the kidney failure, it leads to amputations. So by reversing the diabetes, we can actually prevent you from getting all these complications.
So we're saying reverse, cure. You will not have diabetes. There is good indication.
Okay, we don't say cure because diabetes is a lifelong progressive chronic disease. So you will always have diabetes, but we are reversing some of the effects such that you no longer require medication.
That's
for diabetes.
Phenomenal. Yeah. For so many people who are living with diabetes, the thought of that alone
correct.
is life-changing. Talk to us about the evidence and the strength of the evidence that we have that shows this.
Okay. Metabolic surgery actually started as an offshoot of obesity surgery. And we started doing this for indications for weight loss. People who wanted to lose weight, but as you know, obese people have a high incidence of diabetes. When we started doing this surgery, we realized, hey, these guys don't require medication any longer for diabetes, even before they lose weight.
What a wonderful byeffect that happened.
That's right. And therefore, we started realizing that actually the surgery is even more important in reversing the metabolic effects. So that has how metabolic surgery came about. And now we're doing it for the main indication for reversing this diabetes. What's the question again?
Like, what's the evidence like? What have we seen?
And when we started doing this, we realized, hey, every patient, benefits from this, but we lacked the long-term data to see whether this treatment is effective in the long term, whether it's durable, and whether it has a long-term side effects. But 2 years ago, a very important paper was published in the New England from the Cleveland Group. And it is a randomized control trial with long-term 5-year results.
Gold standard in many ways.
Gold standard. Compares surgery with best medical treatment, intense medical treatment. And it's clearly proven that surgery offers better quality of life. Surgery is effective, is durable, and is very, very, very safe.
That was what we were really looking for, the long-term data.
The long-term 5-year data. And that got us very, very excited. That was 2 years ago, and I think metabolic surgery is something that's going to explode.
Globally, do you see that
Globally,
already?
yes,
in other economies? Is it already on the rise?
In those countries that are starting to be aware that this can be a long-term solution to this big medical problem, the number of surgeries have certainly increased.
Okay, so just to explain to our listeners, when you say that study compared it to best practices, that means people who didn't have surgery and went about with regular treatment for
medical treatment, intensive diet, exercise and all that, as ideal as you can. And most people who are diabetic don't get ideal medical treatment. Talk about in Singapore, the data has shown that 1 in 3 diabetics don't even realize that they are diabetic.
Yeah.
1 in 3 diabetics who are under treatment don't achieve optimal control.
Yes.
So these people who are not treated or who don't have optimal control, these are the ones that are at risk for long-term complications. So this is the group that is is very important to screen them and to pick them up for treatment. And to offer surgery when necessary.
And that's exactly what I want to zoom in on. When is it necessary? Who is suitable for this? How does this work? We'll talk more about the life-saving benefits of metabolic surgery when we return with my guest, Dr. Melvin Look, a consultant general surgeon from Pan Asia Surgery Group. They're at Parkway East Hospital. Stay tuned.
Body and Soul on 938 Now. 938 Now. LTA Traffic News.
After Robin Close. Also roadworks on Stevens Road towards Stevens Drive after Dolby Road. Avoid the left lane.
It takes more than an apple a day to keep the doctor away. Body and Soul on 938 Now.
Imagine a surgery that could reverse diabetes. Well, you don't have to imagine. It exists. Metabolic surgery is what we're learning about from Dr. Melvin Look, who is a consultant general surgeon at Pan Asia Surgery Group at Parkway East Hospital. Dr. Look, tell us a little bit about the big question then. How does this work?
Okay. Like we said before, metabolic surgery is very like obesity surgery, weight loss surgery. And one of the first effects is that if you lose weight, your diabetes will naturally improve because the glucose, insulin resistance improves. But there's also a second mechanism, which was a mystery initially. We find that we do the surgery, and before the patient loses weight, they no longer require medication for diabetes. So initially it was a mystery, but we understand it quite clearly now, that the gut is actually a very important organ for maintaining homeostasis of the body's glucose and metabolic processes. And by rearranging the gut, you can actually change some of the problems that you have with diabetes. So after the surgery, a lot of the hormonal mechanisms of the gut come into play to bring down the blood sugar independent of insulin. So by doing this surgery, the intestinal hormones bring down the blood glucose, so your diabetes is well controlled. And because you no longer need to stress the pancreas so much with the insulin function, you preserve the pancreatic function for longer. So this operation actually has an effect of preventing long-term complications from pancreatic failure as well.
So it's a permanent change in the intestinal makeup of the gut?
Yes, it's a permanent change. Basically, one of the operations, maybe we discuss it a little bit more in detail, is called the laparoscopic sleeve gastrectomy. It is a keyhole operation that we do that basically staples the stomach and removes part of the stomach. So the stomach is converted into a sleeve, like a tube. Okay. Now, what happens is
As opposed to its normal shape,
normal
which is
shape,
like which is different,
that's
like
right.
oblong.
That's right. So the stomach is smaller. You feel full quicker after a small meal. So it's a food limiting procedure. So you start to lose weight because of that. You remove the part of the stomach, the top of the stomach, the part of the stomach that produces the hunger hormone, ghrelin. So you no longer have ghrelin, which means that you no longer feel hungry. So it alters the way you see food and want to eat food, your appetite center. And the third mechanism is that the food that you eat is delivered quickly into the small intestines. It doesn't hang around in the stomach. And when that happens, the blood, the intestinal hormones bring down the blood sugar. And that helps in controlling your blood sugar as well.
I can see that. Just that physical change alone.
Physical change alone, yeah.
Makes that difference already.
Correct.
So you're saying that even before the weight loss occurs, they can see some of the benefits.
Correct, that's right.
Because that mechanism has been altered.
Correct, that's right. Another operation that we sometimes do, and some surgeons do, is the gastric bypass surgery. That has an additional component in that a lot of the gut is bypassed, and whatever food you eat is not absorbed by the gut. So that has an independent effect on glucose control as well.
Oh, so you see, we need to explore this a little bit more and explain, because it's working differently, therefore different pathways that it's working along. Okay, let's go into detail about the type of surgery as well. We'll do that next when we return with my guest. How can this life-saving surgery benefit you when it comes to possibly reversing diabetes? We're looking at metabolic surgery today with Dr. Melvin Look, who is a consultant general surgeon at Pan Asia Surgery Group at Parkway East Hospital. Start sending across your questions at our WhatsApp hotline 963-11938. Phone calls next at 669-11938 as well.
Body and Soul on 938 Now.
At thundery showers over many areas in the afternoon. Temperature 28 to 34 degrees Celsius.
It takes more than an apple a day to keep the doctor away. Body and Soul on 938 Now.
We're back on Body and Soul right here on 938 Now, keeping you in the know and on the go. Let's learn more about what you have in mind when it comes to metabolic surgery. I've been describing the procedure that could be life-saving in so many ways, protecting you from the complications of diabetes in particular. There is strong evidence and good indication that this kind of surgery can actually reverse someone's diabetes. Dr. Melvin Look is joining me, consultant general surgeon out of Pan Asia Surgery Group at Parkway East Hospital. Keep sending those questions across at 963-11938. I'm also going to open up the phone lines right now at 669-11938 if you want to talk to us directly. Let's go to the WhatsApps, Dr. Look. This person has not left their name, but they want to know, can the surgery be reversed after the diabetes is under control? Or the cut, can that be removed as well? Can that be permanently removed? Let's talk about the idea of, I guess, reversing the surgery in some ways. What do you say?
This operation is a permanent operation. It's not meant to be reversed because obviously diabetes is a chronic long-term disease. If you reverse the procedure, you get your problem back again.
Even though you've got it under control, so to speak.
Even though you got it under control. So it's not meant to be reversed. And the part of the stomach that is removed is taken out permanently. So we don't reverse it. Unless you have problems, then we do revisional surgery to correct those problems.
What kind of problems are we talking about?
Long-term wise, actually, the surgery is fairly durable. It's a person living with this operation. Basically lives quite a normal life, except that there's a food limitation effect. You don't take as big a meal as you used to. You take a smaller meal, you feel satisfied with that, and that's basically about it.
Would you need to go back, for example, like we didn't take enough out the first time, let's take more out again?
Okay, the amount of stomach left behind, the tube that we create is calibrated such that it's just nice for you. But this gastric tube can expand for a person who is not motivated, constantly overeating. It can stretch, and that can lead to a loss of effect. In those cases, we can do revisional surgery to correct that problem.
Got it. Okay, thank you so much for that question. We got another WhatsApp coming in, and this person hasn't left their name either, but they're asking, hi, is there any age limit? I am diabetic, age 59, male. I also have high cholesterol, and also wants to know, is this considered as a form of cosmetic surgery? Dr. Look, age limit?
Okay, there is no age limit. But first off the bat, we have to say that this surgery is for type 2 diabetics.
Yes, yes.
So it's not for people who are type 1 diabetics, which occurs mostly in teenagers and young adults. Okay, so that's excluded. So most patients who have metabolic syndrome will be in their 20s, 30s, 40s, 50s. Obviously, if you're older and you have a lot of complications, then probably the surgery will not be worthwhile. So consider doing the surgery when you're young, when you have more to benefit from the surgery.
Right.
So,
but certainly this person who's 59 is not ruled out.
Yes, he's a good candidate. He's an ideal candidate. We would say try to do the surgery early before complications set in. And when do you consider surgery? I think that's an important question. You should consider surgery if your diabetes seems to be getting worse. You know, when you're taking one medicine and you're well controlled, probably you don't need surgery. If you're well controlled on diet and one medication, probably surgery is not required. But if you start needing 2 medicines, 3 medicines, and your doc says, I think you're going to start needing insulin soon, then you start to get, you should consider doing the surgery at that point in time before complications set in. Because once complications set in, then you're not going to be able to reverse the complications.
So we're talking about things like if becoming at risk for lower extremity amputation, or if there's some diabetic retinopathy setting in, things like that. And
kidney dysfunction, kidney failure. The thing about metabolic surgery, we are starting to realize that it is able to prevent complications.
Yeah, which is what we want.
The effect of diabetes on all these end organ disease tend to come in about a decade later.
And we need this. We really do.
With the surgery. Yeah, it comes in a decade later.
Got it. And we do have...
I didn't make myself clear. It delays your problems by a decade later, by about 10 years.
Yeah, I mean, if you're doing the surgery at 59, and if it had set in when you're 65, that means it could set in when you're 75.
Correct.
So you're kicking it down the field.
Yeah.
Got it. And I just want to reinforce something. I mean, the complications are serious. In Singapore, we have some of the highest rates of lower extremity amputation in the world.
I think we're the world leader.
Yes. And I think we have some of the highest rates of diabetes-related kidney failure as well. So these are real nationwide concerns at the end of the day. Is it a cosmetic surgery, he also asked?
It is definitely not cosmetic. We are not doing it for weight loss alone. We are doing it for a medical problem, primarily diabetes and metabolic syndrome. But of course, you do lose weight with the surgery, and that is part of the intended effect. Once you lose weight, you lose a lot of the visceral obesity, and that's the cause of the insulin resistance. Yes.
So I think part of the problem is when these surgeries first became very popularized, there was a lot of celebrity support for it, and people got to know about it when they read about it in those terms, about how I cut the weight and I look different now and I feel different. And I guess in people's minds, it's still classified as very cosmetic in nature.
That's right.
Right, but that's changed, as we're explaining today. Another question coming in, this person wants to know, what about people who are not obese or overweight? Can they also benefit from this if they have poorly controlled diabetes? Is it possible to be very slim and have poorly controlled diabetes?
Yes, these are people who are what we call normal weight diabetics, or non-obese diabetics, or low BMI diabetics. Now we have the best data for surgery for people who are obese and diabetic. We have the best robust data. Obviously, this is the group that most of the studies are focused on.
Okay.
But now we are and traditionally, our indication are related to weight as well and BMI as well. So for Asians, we say that you will benefit most if you're at least 27 BMI and above.
27?
27 BMI and above.
That's just at the definition of obese, isn't it?
That's right. Because we realize that in Asians, we tend to get problems at the lower weight rather than Caucasians. We tend to get medical problems at the lower BMI. So the indication for surgery is lower. Okay, so traditionally we say, at least 27 and above, but there's a lot of interest now in doing low BMI metabolic surgery as well, in order to reverse the diabetes, even though you don't need to lose weight.
Yes.
Yeah.
But you see, I think people would assume that if you haven't got a weight issue, then your poorly controlled diabetes isn't because of weight. But again, we're not just talking about the weight per se, it's also about the gut and the intestinal area that can benefit from that change.
Correct. But for people who are more normal weight diabetics, there might be a secondary issue, or rather a primary issue, which is a pancreatic function issue.
Oh.
Yeah, so in those cases, we got to think very carefully, because if you have a pancreatic function issue, this surgery may not be completely ideal for you.
Understood. Okay, coming up, what's the surgery like and what's life like after it? More with my guest on the program as we discuss this potentially life-saving surgery that could reverse the effects of diabetes. Dr. Melvin Look joins me, a consultant general surgeon out of Pan Asia Surgery Group at Parkway East Hospital. Stay tuned.
Body and Soul on 938 Now. 938 Now. LTA Traffic News.
Heading off for roadworks on Jurong East Street 11 towards Boon Lay Way after International Business Park. Avoid the left lane. And roadworks on Upper Bukit Timah Road to Woodlands after Old Jurong Road. Also roadworks on Marine Parade Road towards Marine Terrace after Marine Vista. Avoid the right lane.
It takes more than an apple a day to keep the doctor away. Body and Soul on 938 Now.
Welcome back to the show, everybody. Dr. Look, let's talk a little bit then about the procedures. As you described, there is a bypass option, there's a sleeve gastrectomy as well. Are these discussed with the patient? Can you choose, or are you only suitable for one or the other? What are we talking?
Yes, the choice of operation obviously depends on how we feel the patient will benefit from the operation and what will suit the patient most. We also discuss the risks of doing the surgery, and the lifestyle changes and all that. Then the patient decides, and we come to a joint decision together. As far as what the operation is like, for example, the sleeve gastrectomy is a keyhole surgery. It takes about 2 hours. After the operation, you stay in hospital for about 3 nights. So it's a relatively straightforward operation. The risks are very low. And it's an operation that is fairly predictable in its effect. Most patients would do quite well with it.
That's interesting, because we often talk about variability and outcomes, but this, we've seen from the data, good outcomes.
Good outcomes for almost everybody, yeah.
How interesting. What's it like adapting? Because when I first started doing interviews on this topic many years ago, when it first came to prominence, a lot of people were focused on what is life going to be like. How do you eat properly? Will you be on a soft diet? Is it liquid all the way? Is that happening in the first 3 days of recovery?
Okay, only in the first week you'll be on a liquid diet. Then you graduate onto a soft diet, and by the second, third week you're back to almost normal diet.
Yeah.
And the good thing is you really can eat what you want, except that
you wouldn't want to eat too much anyway.
Well, the only thing that's changed is the portion size.
Yeah.
So you still can enjoy your steak, but it's a small portion or whatever.
Interesting. And your brain wouldn't want that much anyway.
Yes. In fact, a lot of patients say that the way they view food has become different.
That's fascinating. Yeah. I mean, and satiety is affected as well.
That's right.
Also, mainly because of the size of the stomach in that case?
Because of the loss of the ghrelin producing part of the stomach.
The hunger, the urge. Let's take a question from our listeners. Mrs. Lim has dialed in. Hello, Mrs. Lim.
Hi, doctor. Earlier you said the laparoscopic sleeve gastrectomy is safe and effective for obese adolescents. But I've also read that if lifestyle modifications fail after surgery, these adolescents will gain weight despite the metabolic modification effects of your surgery. So how do you respond to such adolescents? Thank you.
Thank you very much, Mrs. Lim. That's a good point. Let's talk about the idea of rebound, or the weight coming back, particularly if done on younger persons. Like you said, do we mention specifically adolescents?
Usually, this operation is more for older people. Adolescents, they don't get the metabolic syndrome problem so early on. They get purely a more weight problem early on.
Yes, so but this might be done for people in their 20s and things like that.
Correct.
So what is that risk of it coming back?
Okay, obviously, motivation is an important factor. You need to really want the surgery. You want your health to get back on track. You need to be able to understand what the surgery is about. Therefore, not for two people who can't understand.
Yeah.
You need to understand, be motivated, and keep to the changes in lifestyle and diet post-operation. And if you do that, the results are very good. But obviously, there are some cases where you don't eat correctly. You continue to not follow the diet. If you take lots of ice cream, beer,
prata.
Yeah,
I always say prata. 1,000 calories per prata. I mean, come on.
Prata, you feel full, but if you take beer, it just passes through.
True.
So you can pack on a lot of calories, fatty liver, and all that won't go away. So you need to be motivated as well. So there are cases where people go off track, then they start to get a weight regain.
Yeah. So what happens in that scenario?
Well, we try to sort out even before the operation whether you are someone who is not motivated, or you are emotional eater. You snack a lot, or you're a compulsive eater. So those patients may not be so suitable for surgery.
Is there psychological evaluation as part of going through this?
Most people don't require psychological evaluation. By the time we get to the end of our consultation, we can figure out whether you require one or not.
So as Mrs. Lim mentioned, that portion of individuals where it does unfortunately take a U-turn and you're back where you started, but your stomach is half the size already. Is the stomach stretching out? Are you taxing your body even more? Will the diabetes come back worse?
Most cases where the weight rebounds or the metabolic syndrome comes back is due to it could be due to the stomach stretching. So there are some corrective surgeries that we can do.
To help in that situation.
Correct.
I didn't turn on my own mic, so sorry. Let's go to the phone lines where Juan is joining us. Hello, Juan.
Hi, good morning. I'm not sure if this is answerable by the doctor. I was just wondering if visceral fat around the organs are the problem. Apparently, there's a Scottish surgeon that has pioneered a surgery that, where he removes the visceral fat from, say, the pancreas and all that. Is that viable? Thank you very much.
Thank you very much, Juan. Dr. Look?
Yes, some people do what we call omentectomy as part of the procedure. Omentectomy is removing of the visceral fat in the body. Is it time for a funny story, Daniel?
Please. Perfect timing.
About 20 years ago, when I started doing obesity surgery, we were doing all these gastric bands before. Yes. And that's the only option for losing weight. And this French guy comes, he says, "Doc, I don't want a band in me. I just want you to make my stomach smaller and remove all the internal fat."
Okay. That's all he wanted.
That's all he wanted. And we said, no, we don't do that sort of surgery. We can only do bands. But now we realize, 20 years later, that's exactly the surgery we require for metabolic syndrome. Make the stomach smaller and remove the visceral fat.
That's it's come true.
It's come true, yeah. So he was ahead of his time.
Yes.
Okay, but we don't do the visceral fat removal initially. Because most patients don't require that. We'd rather that come down with the weight, let that resolve with the weight. And also we do believe that omentum has an important function in the body. It has a storage function. It also sort of protects the gut against illnesses and all that. So we try not to remove it unless necessary.
And we also recognize that with metabolic surgery, we're not just reducing the size of the stomach. Like you said, we're having some kind of almost permanent effect on the intestines, on the guts, on the flora that's in there, on your satiety, on your relationship to food. Hormonal aspects would change as well, I would imagine.
Correct.
So these are the things, the factors that really go into a lifestyle change.
Correct. And once you lose that weight, once you lose the weight, the visceral fat will go away as well.
Yeah. Thanks for your questions, everybody. Good to hear from you guys. Dr. Look, a pleasure. Thank you for your time.
Thank you. Thank you for having me.
Good indeed to understand and hopefully change our perceptions of this kind of surgery. So now we understand the potentially life-saving benefits of obesity and metabolic surgery. My guest on the program, Dr. Melvin Look, consultant general surgeon out of Pan Asia Surgery Group at Parkway East Hospital. I'm Daniel Martin. This has been Body and Soul.
Body and Soul on 938 Now.